The information provided in this video is for your general awareness, covering the operation of medical gas cylinders fitted with an integral valve. But it is not a substitute for the information provided by your medical gas supplier in their instructions for use or patient information leaflet. Every day, millions of people receive oxygen in hospitals or at home. For many patients, their oxygen is administered using a cylinder fitted with a valve that has an integrated pressure regulator. This type of valve allows the oxygen to be delivered at the prescribed flow rate directly to the patient. By watching this video, you will understand how to operate the valve correctly so that patients receive their oxygen in a safe and appropriate way. However, make sure you have been trained how to correctly operate the specific valve that is fitted to your cylinder. Remember that medical oxygen cylinders are completely white, are fitted with a label stating that it is medical oxygen, should be used within their expiry date. Before talking about the operation of the valve, remember that although oxygen is not a flammable gas, it will strongly support combustion. Things that don't normally catch fire in air will burn violently in oxygen. So you need to keep the oxygen away from sources of ignition such as flames, stove, lighters, and smoking materials. We remind you that valves incorporating a pressure regulator normally have a flow selector and flow outlet for connecting to a mask or nasal cannula, a pressure outlet for connecting to a separate medical device, a contents gauge, and a valve guard. Please note that there are two types of valve that are operated differently. Some have an integrated shut-off valve and flow selector, which we will call a one-control knob valve. The other type has two separate controls, one to open the valve and the other to control the flow, which we will call two control knobs valves. Before using the cylinder, check that it is the right gas by checking the label, the gas is within its expiry date, how much gas is in the cylinder by looking at the contents gauge. If you are using a new cylinder, you will find it has a tamper-evident seal on the valve that you need to remove before use. Remember that the cylinder should be set up before use away from the patient, with the outlets facing away from both yourself and the patient when initially opening the valve. Before you connect the cylinder to the flow outlet or to the pressure outlet, you need to check that the valve is turned on correctly and that the gas is flowing. First, turn on the valve. If you have a one-control knob valve, slowly turn the flow selector to the on position. If you have a two-control knobs valve, you first need to slowly open the shut-off valve fully. Now turn the flow selector up to the maximum flow and listen for the gas flowing. Wait for around 10 seconds and check that it keeps flowing to be sure that the valve is working correctly, and then turn the flow selector back to 0, keeping the valve in the on position. If you are uncertain about the check, refer to the instructions for use or ask a colleague who knows. If you notice any problems with the cylinder at this point, don't use it and inform the gas supplier of the problem. We will now focus on the flow outlet connection operation. Attach the tubing from the mask or nasal cannula to the flow outlet. Ensure the tubing is pushed onto the outlet securely. Move the cylinder closer to the patient, avoiding placing the cylinder on the bed and securing it in an upright position to prevent it falling over. Select the flow rate by slowly turning the flow selector to the prescribed flow and then verify the gas is flowing. You can now fit the mask or nasal cannula to the patient. The contents gauge needs to be checked regularly to ensure that there is sufficient gas to treat the patient. The frequency of checking will depend on the cylinder size and flow rate selected. If the content gauge is digital, it will indicate how long the cylinder will last at the set flow rate. If it is fitted with an analog contents gauge, check the colored scale periodically. The greater the flow setting, the sooner the cylinder will empty. As soon as the pointer is in the red section, you need to be prepared to change the cylinder. Make sure that you have a backup cylinder ready before the in-use cylinder is completely empty. Always close the cylinder valve when changing the cylinder or when you have finished administering oxygen to the patient. For the one control knob valve, turn the flow selector slowly to the off position. For the two control knobs valve, initially close the shut-off valve slowly and wait until the remaining oxygen in the valve stops flowing. Then turn the flow selector to the 0 position. We will now focus on the operation of the valve using the pressure outlet connection, used to supply oxygen to a separate medical device. As the gas consumption will vary with the type of device used, it is wise to start with a full cylinder and to always have a backup cylinder ready. Having successfully checked the valve is working correctly, as described before, connect the hose first to the medical device and then insert the probe into the pressure outlet. Verify that there is no audible leak from the connections. Then you can turn on the separate medical device. When the device is no longer required, turn off the valve, allow any gas left in the valve to empty, and then disconnect the probe from the valve first to prevent the risk of the hose whipping. For two control knobs valves, initially close the shut-off valve slowly, select the maximum flow to vent the flow head, and then return the selector to 0. If the cylinder is empty, return it to the empty storage area. If the contents gauge indicates that there is sufficient gas left in the cylinder, you can return it to the in-use store for a further use. If you noticed a malfunction of the valve during use, label the cylinder indicating the fault and inform the gas supplier. If you have watched this video and understood its content, you should now be able to operate your cylinder valve correctly and safely. If there is something unique about your cylinder, make sure you have read and understood the gas supplier instruction for use. Share this information with all those who need to use the cylinder. Make sure you have been trained. The training information provided does not substitute the information provided by the supplier in the instructions for use and the patient information leaflet.